I'm Tom Heckert. I'm the director of the Bureau of Medical Review here in OHIP. And we are the bureau that does prior approval, prior authorizations, durable medical equipment, private duty nursing, a lot of other things too. You probably dealt with us at some point. Enteral authorizations fall under our purview, as well as the enteral therapy enteral formula therapy policies. So today we're going to talk to you about a few things. Would you go to the next slide? Well, there we go. We have an agenda. Thanks. So we are going to talk to you about our new web portal for enteral authorizations. We're very excited about. Most of you know the IVR, the Interactive Voice Response System, where you have to convert letters to numbers through a keypad, and it can be very cumbersome. Well, we have a new updated web portal where you don't have to do any of that. You type in the information and you can get all of your prior authorization numbers or information fairly quickly without having to use the telephone. Also, we thought with the RX transition happening very, very shortly, that we do a review of the manual where you find information about enteral criteria and coverage, and a brief overview of the policy, and also an overview of how what the authorizations are and how they're done. And then we're going to talk about our new portal, creating portal accounts, and how prescribers, which would be the ordering providers, the physicians, nurse practitioners, or other authorized health professionals who are ordering the enteral formulas, and the dispensers, which are our pharmacy partners and our DME dealer and supplier partners. And then we'll have some time for questions and answers, and we have some canned questions and answers that answer a lot of common ones. And we have some resources at the end of this presentation. This presentation is available on emedney.org on the DME provider manual page. You'll see the slides posted there from previous seminars that we've given. Okay. So yes, just and this is actually a little outdated because the enteral portal is live. It went live March 1st. So we were able to get it up March 1st. So it is available for Medicaid providers to use. It's a user-friendly application, we think, where you can go in and request and activate prior authorizations. We do want to just make sure you know that the IVR, some of you may love the IVR and it may be near and dear to people and they know how to use it, is still available. And this is for people who may not have internet connections or live in spotty areas. You can still go through the IVR, and the IVR and web portal can be used interchangeably. So if you, as a prescriber, enter your information through the IVR, and the DME dealer or pharmacy wants to activate it through the web portal, they can, or vice versa. If the provider puts it in through the web portal and the DME supplier or pharmacy partner wants to activate it with the IVR, they can do that also. And we do want to stress that there are no changes being made to enteral coverage criteria at this time. So the next part is strictly a review. And it is just really to keep people up to speed on what's going on. Okay, and just a brief information talk about the provider manual. Enteral therapy information, you'll find that in section 4.2 of the manual. And they're what we call the B codes. Everybody probably is familiar with the B codes, and that's for infusion sets as well as the formula themselves. And enteral formulas do require authorization without any intervention from us through the portal or the IVR. The codes that require the IVR use have an asterisk next to them, so it's a quick little easy way to say, oh yeah, which is all the enteral formulas, that one I got to go through the IVR for. And just a little Point of order that the ordering provider must request the prioritization and place the prior authorization number on the physical order. Without that, the dispensing provider can't activate. So then the dispensing provider takes that code found on the order and goes to the IVR portal, and by verifying and submitting the procedure code, activates the authorization, which allows them to bill. Okay, so just a brief overview of the enteral formula coverage criteria. The enteral formula benefit is a defined benefit, which means that we've said that these are the parameters that we will allow enteral formula to be used. You can find the actual regulation in 18 NYCRR 505.5G. And you see the first thing it says is this is a defined benefit, and then it lists out the criteria that we will reimburse for enteral formula. So the ones that we reimburse for full nutritional value up to 2,000 calories a day are for members who are fed via tube techniques. So any one of these tube feedings would qualify for 2,000 calories a day. And members with inborn metabolic disorders are covered. These are usually specialized formulas that are lacking in a certain amino acid or a certain fat or protein, which can cause complications because of the disorder. But that is covered under the enteral formula criteria. And also children up to 21 years of age who require liquid oral nutritional therapy, where there's a documented condition where caloric and dietary nutrients from food cannot be absorbed or metabolized. The most common of that would be short bowel syndrome, where there is absorption issues in the bowels. We do cover enteral formula for those members, as well as any other condition that would fit into the absorption or metabolization definition. Also, we do have some adult coverage. So adults with the diagnosis of HIV, AIDS, or HIV-related illness, or other disease or condition, one that comes to mind would be cancer, someone who's under chemotherapy, who are orally fed and have one of the following conditions. So require supplementation demonstrated by compliance of a nutritional plan, and have a body mass index, a BMI under 18.5. If they meet this criteria, we will supplement them for up to 1,000 calories per day. The other next criteria is also supplemental nutrition, but this time the body mass index is under 22. It's a little higher than 18.5, and there's a documented unintentional weight loss of 5% or more within the previous 6 months. So there's something happening that the weight loss is coming off very quickly. We will supplement that condition for up to 1,000 calories a day. Or if it's an adult who requires total nutritional support, having a permanent structure that limits and prevents chewing of food and placement of a feeding tube is medically contraindicated, we will also supplement for up to 1,000 calories per day. So this is someone who may be able to drink liquids of some sort or of that nature. We will provide 1,000 calories a day as supplemental nutrition. So the flow of the authorizations. This is just a slide for the prescribers so that everyone understands how the system kind of works on that end. Your prescribing provider, which would be the doctor, nurse practitioner, or other healthcare professional who is assessing the member and deciding that enteral formula is required, will access the portal or IVR system to request the authorization for nutritional formula. Now it says the providing prescribing provider. That doesn't necessarily mean the provider themselves. It could be someone from their office staff or one of the nurses or someone in the office, but it has to be someone related to the prescribing provider. Then the provider will be required to answer member-specific questions regarding medical criteria. Such as is there a G tube? Is there a inborn metabolic disease? There's a whole algorithm of questions that will lead you down different paths. If the criteria are met, the provider will receive a prior authorization number. So once that number is on the screen or is given to you through the IVR, the number is written and transferred to the physical order, which is then shared with the dispensing provider. So we also have a worksheet, the prescriber worksheet that's in our manual. There's a link in our manual to that, which could help you gather the necessary information before you go to the portal or IVR. It's very helpful in organizing things, especially for people who haven't used either of those systems before. It allows you to write down the information so you have it in front of you and can easily enter the information into the system. Not required, but it's a helpful tool that we've provided for you. Okay, so the provider, the prescribing provider has given the authorization number to the dispensing provider, and that would be the pharmacal, the DME pharmacy, the medical supply dealer, or the DME supplier. They will go to the portal or IVR to access and activate the prior authorization. Once they're into that system, the dispensing provider will enter the HCPCS code. That's the B code that we talked about that matches the formula found on the physical order. So, a B code can be the same for many different formulas. So it's up to the dispensing provider to code the formula that is on the script to the B code. So once that's entered into the system, if the code matches the information entered, the authorization will be activated and available for claims processing. So what will happen if the provider tries to enter a code that's specifically for the inborn metabolic formulas, but the patient is not coded as inborn metabolic, it's not going to activate. So it's kind of a check and balance to make sure that the medical information is matching the B code that's being entered by the provider, the dispensing provider. Again, there is a dispensing provider worksheet that will help you gather information. The link is included in the resource slide here, as well as in the link to it from the manual. Again, it's not required, and for people who are experienced with the systems, it may not be necessary, but for someone who is just starting out using the IVR or the web portal, it's a very, very handy tool that someone can use. Okay, so the automated systems will handle about 80 to 85% of what is covered under enteral formula criteria. Again, it's meant to be a quick automated method to get the bulk of the approvals done without any intervention from our staff, but there are going to be times when there is intervention required by our staff. And intervention is going to be through the submission of a prior approval request form, the EMEDNI form that's mentioned here, or ePaces. You can put a prior approval into ePaces and upload the documents that way. So when we're asking for overrides or something that's not quite right, not quite in the policy, this is the way you do it, through this prior request form. And we just ask that you please make sure you submit your justification, medical justification, when you put the form in, either by paper or through ePaces. So the conditions that we will consider overrides are available, not when the formula is not available, or as follows. It's when the member requires more calories per day than the policy allows. The actual regulation doesn't specify how many calories a day. So 2,000 is what we have set the limit at for members who are tube fed or inborn metabolic. But if there's some reason that someone requires more than 2,000 calories a day, you can submit a prior approval with medical documentation as to why that needs to be the case. Also for oral fed adults requiring supplementation with a BMI between 18 and 21, that would be an instance where you would want to say, hey, we may need your approval for this. Again, they don't meet either criteria, but if there's a medical justification that shows that they, if they're at like 18.6 and they, have been on oral therapy and haven't quite gained enough weight, we may consider extending that. So that's kind of the gray area where they don't quite meet either criteria. And also a third authorization within a year for oral fed adults with BMI under 18.5. The anticipation is that if 2 authorizations are given and you need a third because the BMI is not going up, we want to know why, and we want to know what's going on with that. So that's just kind of a little quirky one that requires a prior authorization. The adult with permanent structure limitations, we do want those to come through so we can see why you would need supplementation, why there would have to be supplementation for that. It is part of the regulation, but we just want to review that specific scenario. And also if a new provider must dispense the enteral product. So you've got an enteral formula from one provider, but you in the middle of the prior authorization, you've decided to switch providers, or the formula is not available from that provider. You have to go to a different provider. That has to come in on prior approval because we have to end the old authorization and start a new authorization. Authorizations are provider specific. The numbers can't be transferred from provider to provider. So that's the quirky ones that we will see. We will ask you to submit prior approval requests for those. So next slide, please. Now the fun part. So the web portal. We're very excited about this. Again, it's been up since the beginning of March. We've had very positive feedback on this. And I'm going to get this out of the way right now. Michelle is going to be presenting this portion of the presentation, but we all call her Mickey in the office. So if during the question and answer period, if I say, Mickey, would you answer that question instead of Michelle? Mickey and Michelle are the same person. We're going to turn this over now to Michelle, and she's going to tell you all about the new web portal.
Thank you, Tom. And thank you everyone for joining our training today. I am happy to demonstrate the portal for you, and I really hope you have a great experience when using it. So let's begin the demonstration. You can go to the link at medicaidenteralportal.health.ny.gov, or you can access the portal by going to the medme.org homepage, and on the right-hand side, you'll find this button that's labeled Enteral Web Portal. When you access it either one of these ways, you'll get to this sign-in screen here on the right. And here you can log in, you can register to create a new account, or you can reset your password if you had any issues. Maybe you forgot your password, or maybe you entered it incorrectly a few times and you got locked out of the portal. You could reset your password this way. So we would have clicked on register to create a new account, and it'll bring you to this screen. You'll choose your provider type. Are you accessing the portal as a prescriber or a dispenser? You'll enter your NPI number and, of course, your first and your last name, and then hit continue. Next screen. And here we will begin the multi-factor authentication setup. So for that, you'll need to enter your email address and you'll hit send confirmation email. You'll check your email and you'll get a 6-digit confirmation code, and you'll enter that here in this screen, confirmation code, and you'll hit confirm. Now you'll need to enter a valid mobile number to receive another confirmation code. So you'll enter that mobile number here, send confirmation text, check your text, look for that 6-digit code, and you'll enter that confirmation code here on this screen and hit confirm. And now you'll be asked to create your 14-character password. It'll need to we require that you have 1 letter, 1 number, and 1 special character. Please remember to write that down. And then complete registration, and your account has been set up. Some tips when creating an account. Only 1 account can be set up per NPI number. The prescriber's NPI is referring to the ordering provider, and the dispenser's NPI is referring to the pharmacy or the DME supplier. Only 1 email and 1 phone number can be associated per NPI. And after your initial account setup, logging in is very simple and really easy. You'll just need your email and your password. A confirmation can be received either via email or text, you choose. And the dispensing provider, when creating an account, will be asked for their category of service. Next screen. First, I want to show you looking at the portal through a prescriber's view. A prescriber has 4 options. They can request a prior authorization, cancel a prior authorization, perform an authorization inquiry, or look at some Medicaid enteral formula coverage criteria. First, we'll request a prior authorization. We'll get this screen and we'll enter the member's client ID number. The Medicaid ID number, remember, has 2 letters, 5 numbers, and a letter. Now, depending on your computer settings, the portal may not accept entries by using copy and paste. I know it's always easier to copy and paste, but I find that the portal runs a lot smoother if you'll just enter the ID number or the date of birth or any information. If you type it in directly, it runs much more smoothly. So here we'll enter the member's date of birth, and that will be 2 digits for the month, 2 digits for the day, and 4 digits for the year. And hit continue. And now we're going to choose a mode of administration. Is that going to be the members using a feeding tube, or will it be oral administration? And is the enteral formula being prescribed for an inborn metabolic disorder? Yes or no? And you'll hit continue. If you answered yes to the inborn metabolic disorder question, you will need to enter a diagnosis code here. Please leave out the decimal point when you're entering in your information and hit continue. Now, are you prescribing more than 1 enteral formula? Yes or no? And then enter the total number of calories being prescribed per day for the formula. And you'll hit continue. Enter the number of refills being prescribed and hit continue. And now If the authorization has been successful, you'll receive your authorization number. Don't forget to write that down. And now you can start over and do it for another client, or you can log out of the portal, and it's that easy. You received your prior approval number. For our next option, before we move on, I wanted to show you if you answered that the patient did not have a metabolic disorder. We can go to the next screen. And you're choosing oral administration, and you're choosing no to the inborn metabolic disease question. Continue. You're going to receive just a couple other questions. Are you prescribing more than one enteral formula? And of course, we'll need to enter the total number of calories per day for the enteral formula. Hit continue. And the number of refills, just like before. But this time, we're going to need to enter the member's height in inches and the patient's weight in pounds. And hit continue. And then you're going to receive a few more questions about the member's medical condition, such as, do they have a medical condition that prevents them from consuming normal table foods? Or have you tried any dietary alternatives? Has the adult patient had significant unintentional weight loss? Or has the pediatric patient had no weight or height gain? And you'll answer yes or no to these questions and hit continue. And is there medical evidence in the record to support your request? Yes or no? And then you'll get a reminder to write the diagnosis code on the script as the ordering provider. And you'll hit continue. And you'll always know that you have been successful in your process when you receive this screen, that the prior authorization is successful, and you receive your prior authorization number. Now I'd like to show you the second option as a prescriber using the portal. You can cancel a prior authorization here. Now, once a prior authorization has been activated by a dispensing provider, it can no longer be canceled using the portal or the IVR system. So if it has already been activated, we can't go through this process, but prior to activation, you can go in and very quickly cancel a prior authorization. So you'd hit cancel prior authorization and next screen. You'll be asked to enter the Medicaid member's ID number here and the date of birth of the member. Hit continue. Enter the prior authorization number that you wish to cancel, and it's really quick. The PA has been canceled. You'll always know that your process is successful because the portal will show you PA canceled successfully. And now the prescriber can also perform an authorization inquiry. And this is a nice way to get some information. So we'll enter the member's client ID number here. And we'll receive a screen that shows you the total number of calories per day currently authorized for the member. And you'll hit continue and you'll receive a little more information. Now this time, this information is what is associated with your NPI number. So it's a little more detailed. You'll see the PA numbers that you have ordered with the refill, the number of calories per day, And what I really like is it gives you the earliest date that the formula can be reauthorized. After you receive this information, you can perform an inquiry on a different member. You can hit start over, you can log out. And our next screen will show you can look at some Medicaid enteral formula coverage criteria. It's a little generalized statement that tells you that Medicaid covers enteral therapy when it is an essential component of the medical treatment plan ordered by the prescriber. If you need more detailed information, we always encourage you to go to the DME manuals to go to the procedure code manual, and you'll get more information about coverage criteria and policy. Now, as a dispenser, I want to show you the dispenser's point of view. As you see, the fourth category here that you can pick from is Medicaid enteral coverage criteria, which is the same as we just showed you as a prescriber. So we won't demonstrate that one again. But we have 4 options as a dispenser. And the first option is to dispense an enteral formula. So we'll click on that and we will receive this screen where you will need to enter the prior authorization number that's written on the script and hit continue, and then enter the member's client ID number and hit continue. Here you'll enter the 4-digit enteral code that is being dispensed. We ask that they are the numbers only. Please leave off the B. And you'll hit continue, and you'll get a regulation reminder that providers are required to dispense the least costly generically equivalent formula to meet the medical need. And hit continue. It'll ask, the portal will ask you, does the member has been authorized for a certain number of calories per month? And it will give you the enteral code that you requested and the number of refills. And it asks you, is the amount sufficient per order, yes or no? And you'll hit continue. Once the authorization has been successful, you will receive this screen that says the information entered into the records is accurate and you have prior authorization to dispense this request. You can click start over to dispense another authorization, or you can log out of the portal. And our next screen, the second option as a dispenser is to perform an authorization inquiry. And it'll give us a little bit of information we always start with entering the Medicaid member's client identification number. And then you'll receive a screen that tells you about the total number of calories authorized for the member, the total number of calories per day and month. And if you hit continue, you'll then receive a little more information about the authorizations that are associated with your NPI. And as before, this is more detailed, where it'll give you the PA number, it'll give you the enteral code, and it will give you the earliest time the formula can be reauthorized. And you hit continue here. Our third option as a dispenser is clicking on paper prior approval requests. And this is an option where it tells you a little bit about ordering paper forms, where you can always call 1-800-343-9000 and order the form 361502. And that would be when you're using a paper form. It gives you the address to mail the forms to. And it gives you some PA guidelines, which will help you go step by step through the form and how to fill it out before sending it in. So this is a really helpful screen. And then you could go to the Medicaid enteral coverage criteria as shown previously under the provider to get some general information about our coverage criteria, or you can always, we encourage going to the DME manuals at emedney.org, and you'll see more detailed information about our policy and our coverage criteria. And that's the demonstration as a prescriber and as a dispenser using the portal. As you see, it's very user-friendly. I'm really happy with the way this portal has turned out. And our first common question: what are the benefits of using the portal for prior authorization? The portal will allow users another option to the IVR for enteral prior authorization requests. I think it's a faster, easier process, and I hope you will find it too. Our second question: have any changes been made to the IVR? No, the IVR call number remains the same at 866-211-1736. And our third question: if providers have any PACES account, are they already set up to log into the portal? No. The portal is a separate sign-in screen with different credentials. So you'll need to go through the steps of creating an account, a user ID, and a password to use our portal. Will paper prior approval request forms still be available? Yes. Paper prior approval request forms are still available. You can order them by calling 1-800-343-9000. Some resources we wanted to get down and combine onto one screen. This is the link to reach the Medicaid portal. It's Medicaid Enteral Portal.health.ny.gov, and the IVR number at 866-211-1736. As Tom said, keep in mind that these are interchangeable. You can request a prior approval on the IVR and activate it on the portal, or vice versa. And we have an updated prescriber's worksheet, which is a great way just to gather all your information together and keep it in the record, or just use it to go through the portal and the IVR. It makes it much easier to have the information in one spot. Here's the link for the prescriber's updated worksheet and the dispenser's worksheet. And then we have the enteral product classification list, which is nice to print out and have all in one spot also. And our next screen, we have posted the slides. As Tom said, that this PowerPoint is posted on the Emedney page under DME manuals, and it's at the very bottom. You can contact us with any questions. We're always available to help. You can call us at 800-342-3005, option 1, and ask for Mickey. I'll be happy to help you with anything concerning the portal. Or you can write in your questions at ohipmedpa health.ny.gov. And those questions will probably come to me. So you'll see the answer from Michelle Pascarella as well. We're here to help you. It's been very positive and we haven't really had many difficulties with the portal. We're finding that it's working very well for everyone. Thanks, everyone.
Thank you, Tom and Michelle. We're going to open now for the chat of questions now. So anyone putting in information, please put it underneath the chat section underneath everyone so they can see your questions. So Tom and Michelle and whoever else on our side can help you with your questions. Thank you.
Hi, thanks. Yeah, so the first question that we got does kind of highlight, unfortunately, one of the issues, I wouldn't say issues, but one of the shortcomings of the portal. It's provider specific. So as Mickey said, it's each NPI can only have one email address associated with it and one phone number. So and if you have multiple doctors in an office, they each have to have their own login. So that does make a little more difficult for multiple providers. Some of the remedies to that are, if there is a group number, you can always have the group number be the ordering provider and have it all under the group. The issue with that is you're not going to know exactly which physician is ordering it. The other option is the IVR does not require, the telephone system doesn't require you to have any kind of login information. So you can go in under the IVR for each individual one. Again, that's something that we are looking at to see what we can do. It's really a security issue with these types of portals that causes it to happen that way. So at this point in time, you're going to have to activate with an email for each provider and an NPI for each provider. So I mean, you may want to set up a bunch of emails in your practice, you know, Dr. So-and-so portal, Dr. So-and-so portal, Dr. So-and-so portal. That's one way of around it, where you have different email addresses for each one of the providers' MPI numbers. So again, and then you'll have to go back and switch between the email addresses when you log in each time because of the multi-factor. Yeah, and it is something that we're looking at. Again, I like I said, I don't know how far we'll get with that. Again, it's really a security issue that came from our security and privacy team that said we got to do it this way.
And you'll only need that cell phone number the first time for setup. You can request from then on to receive your confirmation codes through email. Yeah.
Yeah, so it's the setup that's the problem. It's after that, it's email is available. It's a little easier. And if anybody, okay, here we go. Okay, Mickey, we'll have, I don't know if you can probably see this too, as a dispensing provider, if the PA obtained is not for the correct amount of calories written on the order, and they indicate that during activation, the PA will not activate and be sent back to the prescribing provider. Do they have to go back to the
Yes.
prescriber to fix that, or do we need to request that the PA be canceled and reobtained? So at that point, it's not in the PA, it's not in the eMedNI system, it's only in the IVR portal system. So Mickey, they would go back to the provider, correct?
Correct. It hasn't crossed over to the eMedNI system, so you'll need to go back to the provider to get the correct number of calories on the
written order. Can the provider change that, or does the provider have to cancel that and then start again?
Cancel, please cancel that PA and start again.
Yeah. So if it doesn't activate, then you'll have to go back to the provider and have them cancel the PA and re-enter it for the correct amount of calories. What other tips and tricks can we think of that we've learned over the past few weeks, Mickey? Providers who used it liked it.
Yes, I haven't had really anybody having any difficulties with it. It's going very smoothly. I think that everyone's finding it as a much faster process than getting on to the IVR and trying to remember what number goes with what letter when entering a Medicaid ID number. It's quicker just to type it right in.
And we worked with a major pharmacy chain in conjunction with the transition coming in the next couple of weeks on their process and procedures. So I mean that was exciting for us.
Yeah, they were doing a big training on it. Yes.
And I know that the NPI, who's the NPI for the dispensing can be a little tricky, because I know in pharmacies that pharmacists have their own NPIs. But in this instance, on the pharmacy or the DME side, we're looking for the NPI of the organization dispensing. So it would be the NPI of that pharmacy, and not necessarily of an individual in that pharmacy. Whereas on the other side, for ordering prescribers, we're looking for the NPI of the individual ordering provider or the group NPI. Okay, for dispensing pharmacies, the category service 441 or 442. The category service is going to be 442. That's pharmacy DME. So you need to have that category of service on your file. Okay, with the new Medicaid coverage, Medicaid change or formula on 4.1, does the PA have to begin after April 1st when a managed care MCD is in place, or can we retrieve a Medicaid off prior to, or can we get a Medicaid off prior to April 1st? So this is really a transition question. The authorizations for Medicaid managed care people will not be available to be obtained until after April 1st. So if you are dispensing formula before April 1st, then you need to bill that to the managed care organization. Anything you dispense after April 1st will come to fee for service, and that's when you will have your authorizations. Now, I will tell you, we are giving people a grace period of a month or so, and we will be able to manually approve some enteral formulas that may not have a PA if they come through. And if that does happen, we will call you. We're going to keep track of those authorizations that we force approve. And then we'll call your organization and say, hey, don't forget you have to get a PA number, and then we can walk you through anything. Actually, I should say we're going to call you. You're first going to get an email saying this is what you do. And then if you are a repeat offender, then you will get a call. But we're hoping everybody will come into compliance fairly quickly, especially with the new web portal, since it is so easy to use.
We have another pharmacy benefit transition question.
Okay, if there's a prior authorization in place with an expiration after April 1st, is it valid? No, you have to resubmit after April 1st. Well, I shouldn't say that. If it's an MCO member, if it's a member from an Medicaid managed care plan, and their authorization continues after April 1st, you have to resubmit that into fee for service when they come over to fee for service after April 1st. We are not able to take existing prior approvals from MCOs into the eMedNy system for supplies. I know they are doing that for drugs, but it doesn't work for supplies. So any prior authorization in place through the MCO, you'll have to re-obtain through the IVR or web portal after April 1st. In the future, will there be an option for prescribers to obtain the manual prior approval and upload supporting documentation, or is it strictly for the dispensing providers to submit? That is, yes, ordering providers, prescribers cannot upload and obtain PAs. PAs are, paper PAs are provider specific. So that's why the DME dealer or the pharmacy has to submit the PA. So in that case, you have to get all the supporting documentation to the DME dealer or to the pharmacy, and they have to submit the prior approval. So it's under their provider number. So at this point in time, there is not a way for the ordering providers, the medical providers, providing the information to obtain a PA. It has to come from the DME dealer or the pharmacy. And that's the way all of the prior approvals work in durable medical equipment, prosthetic, orthotics, and supplies. They're all driven by the person who is dispensing the and getting payment for the item. And again, we will be around for through our email. You can email us anytime. We do have our phone call center, which is specific for DME, just DME and supplies. It will be available Monday through Friday, 8:30 to 4:45. The weekend of the go live for the pharmacy carve out, we will have that call center manned that Saturday and Sunday. So April 1st and April 2nd, there will be a limited support for those days, specifically for carve out questions. So, we don't, we're going to be taking questions about carve out issues those days. But we do have telephone support that you can access, as well as email support that you can access. And again, there's a wealth of information on in the provider manuals. There is the ordering forms, the website, on the website, the prescriber worksheets and the dispensing worksheets, which are good for people who aren't familiar with things and want to use those. And then Mickey said too, they're a good way of kind of organizing and keeping the information in the chart. I mean, all the information should be in the chart elsewhere, but at least if you put it in the form, put that in the medical record, you have something to say, yeah, this is what we use based on the information in the chart. So that's helpful. One thing I do just want to mention about the Enteral product list that Mickey mentioned, that is not a be-all and end-all list of products that are approved by Medicaid. It's a helpful guide for you to see if you know the name of the product you're looking for. It'll help you code it. Again, it's we try to keep it up to date as much as we can, but it's not meant to be a formulary. It's not meant to be anything that's the only what we cover, or if it's not on the list, we don't cover it. So I mean, it's meant as a guide, but just please be aware that it's up to the providers to correctly code it, so that you can use it as a guide, but you should check other methods too, just to make sure the information is correct. Okay, it says if enteral supplies are delivered for 30, yep. So if they're delivered on 3/20, they don't need it to 4/18. Yep. Managed care. Yep. Managed care. We go on a date of service. So you bill for the formula for 30 days of service on 3/20. The managed care plan will pay for 30 days of service. When you bill us on 4/18, then we will pick up and start billing and paying for 30 days. So that is our understanding, that the billing is date of service driven. So we are going to be posting a recording of the presentation. We've recorded a few of them. We're going to kind of take a look at them to see which is the best one, but there should be one available for people to listen to in the future. Yep, without a staggered rollout, where they're talking about staggered rollouts. Yep, that's going to happen. Again, like we said, we are going to relax the PA requirements for about a month, so possibly 2. So, you know, again, your claims will be paid, so you may want to stagger them yourself. You know, do so many a week over those 4 weeks. You know, yes, unfortunately, there isn't going to be a staggered rollout. It's a date in the sand for the cutover on April 1st. So, you know, I understand that that's a lot of volume, but there's nothing that can be done about that with the way that the cutover is being done. Again, it will stagger itself, you know, if they're not all going to be due on April 1st, so you don't have to put them all in on April 1st. You just need to put them in as you're starting to dispense them. So if you want to look at when you know, the dates are dispensing, you may want to make a chart, and like 2 or 3 days before, you know, you may want to make sure that the provider has given you the information so that you can put the PA in to activate. Again, this is going to require some work with the providers as well as with the dispensers, because you can't do it without one with the other. So again, I probably would look at the dates that the formulas are supposed to be dispensed and kind of stagger them that way. They'll naturally stagger. Hundreds expire at the same time frame, multiple times per year going forward. What is so again, that's going to be up to you how you're going to manage this. Again, we're talking about that previously. You may want to, you know, divide it up into you know, a chart, so you know when people are expiring every 6 months. You know, you have this one that goes in on April 1st, you know, then you April, May, June, July, August, September, October. You have to do it at the end of September, and then you know, in the middle of April, the ones go in the middle of October. Again, that's something that the office is going to have to work through and figure out how they're going to do this. Yeah, that's just the way it's gonna work. It's the authorizations will be every 6 months. But again, with the IVR, it should go fast. I mean, you don't have to.
Yeah.
So if it's the same provider, you know, you don't have to log out each time you do a member. So, right, Mickey? So they can
Right.
stay
Just
in
hit
there.
start over and put in the new Medicaid ID number, and then just keep going. It'll be a really quick process, actually.
Yeah. So, I'm not seeing any more questions.
If they have any other questions, they can always contact us, Tom, please call our number. We'd be happy to help you, or send in an email to us if you have any trouble setting up an account, or you've already set it up and you're having trouble using the portal. I'd be happy to help you.
Yeah. Okay, so I think we're going to turn it back over to Marcy at GDIT to kind of close out everything today. I don't, like I said, I'm not seeing any more questions. But again, if you do have a question, please either email us or give us a call, and we'll be happy to help you. So, Marcy, I think we're done for the day.
Thanks, Tom. Yep, I was just going to say, it looks like the questions have slowed down. Everyone, thank you for joining us today, and especially to our guests who went over the presentation today. Again, as they said, any questions, contact them, and you also have the other information on this screen. So if there's no further questions, again, enjoy your day, and you can exit out at any time. Thank you.